The work of firefighters and emergency medical service personnel is physically and emotionally demanding. Emergency service personnel are routinely called upon to respond at a moment's notice, lift heavy equipment and patients, and risk their lives for the good of our community. The care and well-being of people and property are often thought of as most important. However, if you are experiencing musculoskeletal pain or if you become injured, it will compromise your ability to respond safely and effectively. The most recent National Fire Department injury data shows sprains, strains, and muscular pain are a problem for fire and EMS personnel. They account for the highest percentage of injuries, even outranking injuries due to burns, stroke or heart attack, smoke inhalation, and wounds and bruises. For example, 50% of injuries due to traveling to and from incidents, 42% of injuries occurring on the fire ground, 57% of injuries during non-fire emergencies such as EMS responses, and 59% of injuries during training activities. One of the ways to reduce sprains, strains, and musculoskeletal pain is by applying ergonomics. This video is intended for fire and EMS personnel to review ergonomic principles. We will talk about what ergonomics is, what musculoskeletal injury risk factors are, what ergonomic solutions are, and finally, how these apply to you. Ergonomics is defined as modifying the task or environment to fit the anatomical, physiological, and psychological capabilities of the worker. It is about the relationship between the worker, the task, and the environment. In this example, the firefighter is removing a ladder from an engine and setting it. Some of the worker factors that could affect this relationship are his or her age, height, upper body strength, experience, fatigue level, and stress. The task he is doing is handling the ladder. Some of the task factors include the ladder's weight, length, the method he uses to lift and carry the ladder, for example, carrying it on the shoulder or at the waist level, and the number of people available to assist. Finally, the environment in this example takes place at a fire scene. It may be noisy, cluttered, and the ladder may have to be carried extended distances. Beyond this example, there are other worker, task, and environmental factors that arise with the variety of work activities that you do. Can you think of any? Injury risk factors are postures or activities that can lead to acute and cumulative trauma injuries. There are several musculoskeletal injury risk factors that fire and EMS personnel commonly face at work. Awkward postures are any postures that are not in a neutral or anatomical position, such as reaching with your arms overhead or away from your body, and bending or twisting your torso at the waist or neck. Excessive force means exerting large forces, such as when you push, pull, or lift. For example, lifting the fan or handling patients. Repetition is performing the same motion over and over. It can be highly repetitive over a short period of time, such as when pulling down a ceiling, or low repetition over a long period of time, such as the common activity of putting the gurney into the medic unit. Impact forces are large forces transmitted to parts of the body by contact with the ground or a hard surface, such as the force on your feet, ankles, and knees when you jump out of your vehicles. Excessive temperature occurs during very hot or cold conditions, which can compromise your soft tissues, such as when you are fighting fire in your protective gear or during your training drills. Whole body and hand-arm vibration result from activities such as riding in vehicles or operating powered hand tools. These risk factors may not result in immediate injury. However, if you increase frequency, duration, or intensity, or you combine the risk factors, this increases the risk of an injury or an eventual disability. An example of combined risk factors is when you are moving a patient from their bed to the gurney, which is a common activity that involves awkward postures and forceful exertions. Once you are aware of what risk factors are present, it is important to come up with solutions to eliminate or reduce the risk factors. In general, you want to reduce the time, frequency, or intensity of the risk factor. There is a hierarchy for basic ergonomic solutions. Some solutions are very effective at reducing the injury risk, but may be very involved, while others may be less effective, yet easier to implement. Oftentimes, the most effective solutions are not in your personal control and take an involved departmental approach to reduce the risk. At the top of the hierarchy for being effective is equipment and engineering to eliminate the risk, followed by job organization, then personal protective equipment, and finally, body mechanics. While you may already be doing some of these things, the following examples are meant to illustrate different types of solutions in the hierarchy. The most effective ways to reduce risk are equipment selection and engineering controls. Using appropriate ergonomically designed equipment or redesigning current equipment can reduce your injury risk. One example of equipment selection is the type of medic pack carried on calls. One type is this hard case. These weigh 12 pounds empty and must be carried away from the body due to their shape. An alternative is a soft pack with shoulder straps. These weigh only 3 pounds empty and can be carried closer to the body. Also, consideration should be given to the supplies that are carried in your pack. Reducing the supplies down to only essential items can decrease the weight that has to be frequently carried. Another example of an equipment selection is a lateral transfer device. Slide sheets are made of a slick material that reduces the friction during lateral transfers. This decreases the stress to your low back. They are lightweight, can be stored quickly, and are comfortable for the patient. There are a variety of styles available for your equipment committee to consider. An example of an engineering control is this bariatric ambulance. It uses a special gurney that travels up a ramp pulled by a winch mounted inside the medic unit. This moves the patient safely and quickly into the medic unit without using any manual force from the emergency service workers. These types of interventions need to be approached through the safety committee and may involve the survey of the department's needs. Also, equipment purchasing committees should take ergonomics into consideration. Line personnel can really provide valuable input to safety and equipment committees since they know what might work best. Changes in your job organization or work practice can also reduce injury risk. An example of a job organizational change is having 4 people lifting the patient instead of 2 or 3 people. Even with 4 people lifting, using proper body mechanics is still important. Are all these people using good body mechanics? Another example of an organizational change is 2 people carrying the fan instead of 1. Both of these examples decrease the weight being carried by each person. A work practice change could consist of using a handle and stepping down when exiting vehicles instead of jumping. This reduces the impact force to the lower body and decreases the risk of spraining an ankle. Even in the office,